Hello, my name is Eoin. I'm a radiologist in Galway University Hospital, and my project is exploring how existing data can be better used to augment communication between clinicians and radiologists, specifically around the ordering of CT scans. Radiology is a very busy service and it is getting busier and more complex. There's increased administration and recently a large increase in the number of phone calls. And these have been shown to lead to burnout. And burnout does have serious adverse effects on patient care. It can lead to delayed or inappropriate imaging, and it can lead to misdiagnosis. So this is a data science project, and I've used the CRISP-DM methodology. First, you look at your business, find out what you want to find out. You look for sources of data and then try and prepare that in such a way that you can feed it into AI or machine learning algorithms to try and look for new insights or new bits of knowledge. Then you have to evaluate those insights, make sure they are accurate. And this is cyclical. This may feed back into your business understanding or it may lead to a model that you can deploy. I'm using the Knime analytical platform. It's open source, free to use for the data manipulation and modeling aspect. So to understand your business, the best thing to do is get up and talk to people. I did that in surveys and spoke to radiologists. They want to know, they want more information from the clinicians. Specifically, they want to know what's the indication for the scan, why do they want it done. They want to be interrupted less, and they feel that they're repeating the same messages over and over to new doctors. Doctors want to know, will the scan be performed and when it will be performed. And interestingly, many felt they were never taught what actually made a good request. So they don't know what to put into the clinical information, and we're giving out to them for not putting in what we want. The admin staff are stuck in the middle and they're fielding more and more calls and find it difficult to do the other jobs. So our business need is to answer the most frequently asked questions before they've been asked. We have a data science project where we can find out any new order, what's its place in the queue relative to similar orders. And based on that, can we estimate how long it's going to be before it's performed? Then we've also identified that clinicians don't know how to do a clinical request. This could just be solved by changing the user interface and providing that information at the time of inputting an order. Our data goes back to 2006, stored in a data warehouse. It's very rich. It provides data on when scans were ordered, performed, clinical information, what priorities they've had, what departments they're in, etc., etc. But not all of the information is relevant, so we have to pick what is. It also holds interesting stories. Here we can see that the mean number of images per CT has risen tenfold over the last 10 years. First, you have to prepare your data. If you don't prepare it, your insights or new knowledge will not be valid, will not be reproducible, it will be meaningless. You can also use it to prepare new variables that can be fed into your algorithms, such as the mean waiting time, place in a queue, or by looking at free text, you might be able to pull out topics or common themes running through the clinical information. This is just one experiment we did. We tried to predict if a scan will be performed the same day that it was ordered, based on its theme or its topic and other variables, and we were able to tell this with 90% accuracy. You always keep some data aside to test your model on afterwards to make sure that it is accurate, and it did hold up around 86 to 95% accuracy. If you do get a good model, the ambition is to deploy it. This does feed back into your business understanding, but it's not so simple as just leaving it out there. You need to constantly evaluate it and make sure that it is still accurate. So what are the next steps of this project? It would be nice to deploy one of the algorithms, but first we need to secure access to live data and test this in real world conditions. I'm speaking with the vendors to do that. But I think the big thing from this project is that I would advocate for the hiring of dedicated data scientists. This is a specialized field, but there are very, very interesting insights and useful information available that a qualified person would be able to pull out. And they should work alongside clinicians. The second thing I want to improve is the user interface. So when a new doctor orders a CT scan, it should be more intuitive. You should tell them what information that they put in. And if things change, like when COVID came in and we want new information, that should be prompted to the users then as well. So, as I said, not all changes need fancy AI or machine learning. It could be simple tools. The text mining, pulling the topics out of information, that could be avoided if there was instead a drop-down box when the clinician was ordering that allowed them to select why they wanted the scan done, such as acute head injury. Data science projects, you can't just deploy them and forget about them. You need someone to look after them, to foster them. We do need data scientists. They should work alongside clinicians to better use the really, really rich data that we do have available. Why should we do this? Because the consequences of not doing it are real. Interruptions, burnout, they can lead to bad outcomes. Thank you very much for your time.